In this video, we will take you through the process of an appointment with one of our sleep doctors. We will also go through what to expect if the doctor recommends you for a sleep study. You can either be referred to our sleep clinic by another physician or refer yourself if you believe you have an undiagnosed sleep disorder. Our sleep clinic is located on the 7th floor of the iBank building. When you arrive to the sleep clinic, go to the front desk and sign in with our receptionist. You will receive a pre-assessment form to fill out and give back to the receptionist. This pre-assessment will better allow your sleep specialist to understand your history and what problems brought you to the clinic. Just like any normal doctor appointment, a nurse will call you back, check your vitals such as weight, height, and blood pressure, and place you in an exam room to wait for the doctor. Your sleep specialist will ask questions about what brought you to the sleep clinic, your sleep habits, and other important questions. If your sleep specialist believes you may have a sleep disorder, you will be directed to the 6th floor, where our sleep testing center is located, in order to schedule your sleep study. Once on the 6th floor, you'll let the receptionist know your sleep specialist has asked you to have a sleep study scheduled. You will sign in, and one of our patient service coordinators will be with you shortly. In your consultation with the patient service coordinator, you will go over a number of things to prepare you for your upcoming sleep study. First, you will sign a few consent forms, which is standard practice. Next, the patient service coordinator will go over the cost of the study, what your insurance will pay, and what your out-of-pocket expenses will be. Payment must be secured before the study can be scheduled in order to prevent cancellations and empty beds. After payment is secured, the patient service coordinator will go over many of the things we will discuss moving forward in this video. They will explain how to prepare for your study, when to arrive, and what you may bring along with you. If you have any questions at all, make sure to ask. We want you to feel as comfortable and prepared as possible for your upcoming test. Leading up to the night of your sleep study, you will receive a call from our office to remind you and to confirm your study 2 nights before and the night before. If you cannot make your study and need to reschedule, we ask that you call and cancel at least 24 hours before your study. When arriving for your study, you will park on the south side of the iBank building, the side adjacent with Poplar Avenue. There are parking spots designated for Mid-South Pulmonary and Sleep patients, which you may park in. You will arrive at the iBank building at 8:30 p.m. for your sleep study. You will sign in with a security guard on duty and wait in the lobby by the elevators with the other patients who have studies that night too. A member of our staff will show you to your room for the night, allow you to change into your nightwear, then explain the amenities of your room you are staying in. Since usually we have more patients than sleep technologists, the sleep technologist may show you to your room and then attend to the other patients for some time. In this instance, they will show you how the television works and give you the Wi-Fi password, and you may relax until the sleep technologist returns. Your sleep technologist will have you fill out some consent forms and then escort you to the prep room. In the prep room, your assigned sleep technologist will hook up all the sensors for the sleep study to your body and will explain to you what each sensor is for. Every sensor has a unique purpose and are essential to the doctor for reading data collected during the study. If you have any questions or concerns, please ask your sleep technologist. Again, we want you to feel as comfortable as possible for your sleep study. After properly attaching all of the sensors, your sleep technologist will take you back to your room and put you to bed. The sleep technologist will plug all of your sensors into a machine that feeds data to our computer system. Lastly, your sleep technologist will have you perform some minor tasks in order to properly calibrate the sensors for your study. These tasks are things such as blinking 4 times, coughing twice, and counting to 5 out loud, among a few other things. Your sleep technologist will then ask if you need anything else before the test starts. Say goodnight and turn off the lights. You may be awoken in the middle of the night because of a sensor falling off and needing to be reattached. Your sleep technologist will try to be as quick and quiet as possible reattaching the sensor. Your sleep technologist will stress to you that if you need anything during the night, do not attempt to get out of bed without assistance. If you need anything, such as a glass of water or a visit to the restroom, use the intercom located next to your bed. Your sleep technologist will be there as quickly as possible to assist you. Trying to get out of bed without the assistance of your sleep technologist can cause serious damage to the equipment and, more importantly, jeopardize your safety. In the morning, you'll be woken up between 5 o'clock and 5:30 a.m. Your sleep technologist will remove all of the sensors attached to you and let you know if the data collected from the study is adequate enough for the doctor to read. Because we are always trying to improve the quality and comfortability of our overnight sleep studies, your sleep technologist will ask you how you feel and how your night was. They will also give you a card with a link to an online survey about your stay. Our goal is to have you done with everything and headed back home by 6 a.m. If you need to take a shower before you leave, we have a shower you are more than welcome to use. Some patients will be done with their sleep studies, but some of you will be staying for daytime nap studies. In this case, your new sleep technologist will introduce themselves to you. They will also give you a menu for you to pick out breakfast and lunch. With the nap test, you will be asked to stay awake for 2 hours. During those 2 hours, you may watch TV, use the electronic devices you brought with you, or get up and walk around. When it is time for your first nap, your day shift sleep technologist will put you to bed in the same fashion as the night before. After your first nap, the sleep technologist will wake you up, and you may continue what you were doing before your nap, including eating the food you picked out earlier. The cycle will repeat until enough data is collected for the doctor, at which time your study is over and you may leave. Before the doctor looks at your study in order to make a diagnosis, a registered sleep technologist will go over all of the data collected during your study. The sleep technologist will identify at which points during the night you entered the different stages of sleep. They will highlight any apnea events and score the severity of the events. They will also highlight any times during the night when your sleep may have been disturbed, your oxygen levels dropped, or your heart showed an irregularity. They will also make notes and flag any video evidence they believe will be useful to your sleep specialist. The sleep technologist generates a report for the doctor, at which time the doctor makes a diagnosis based on the given information. After that, you will be contacted with the results of your study, and we will proceed with treatment options. We hope you found this video helpful in preparing for your or your loved one's sleep study. If any questions you have were not answered, please don't hesitate to call us. Again, we want you to feel as prepared and comfortable as possible. And thank you for choosing Mid-South Pulmonary and Sleep as your preferred sleep specialist.